This is Because Teeth Podcast with Greg Santiago and Cody Preble. All right, back on the pod with another episode.
Episode P today.
So today's episode, we're going to be talking about different study strategies and how we study, and basically offering insight of what we're doing, what we're not doing, what we want to do more of, what to incorporate with our studying, and basically just any and everything when it comes to really studying for a big, standardized test, regardless of it being a dental hygiene board or any type of, standardized test. So
yeah, because before we touched on a little bit of what we were going to be doing to prepare for it, and you all heard our board review thing, and it's kind of like the process of going through it. So kind of see how we're handling this whole exam and
yeah. So that way, anyone that's going through any type of dental school, whether it's dental assisting or dental hygiene or, actual dental school, kind of, get a live feedback of like what we're going through our last semester and working up to the last semester and how we're basically handling everything and managing it. So, without further ado, let's just go into it, man. So, the first thing, I think the most common mindset and question that I know I had when it came to basically when to start studying, and also like how long and how much. It's just like the whole time frame thing. So, I guess, you start off with like how much, or I guess really when we started studying. So like, I guess talk about like when you started studying, and how much you've been studying and working up to this point. Cause we still have basically, it's a little over a month till our actual
I think
test
when I
date.
saw today, I'm out like 40 something days. So
counting down.
Yeah. I know around 60 was kind of that, like 2 months out is what we had at first in our head.
Yeah.
Thinking like, oh, once we get to 60, we'll get going. But
for sure,
I think I kind of bypassed that mark and let that one sneak in on me a little. And now I'm kind of holding it till I think 30. Yeah. I mean, not to say I haven't been studying since these other ones. I definitely have, but I'm not in it every day, multiple hours a day. I think 30 is when I'm really gonna hit that. Yeah.
Well, I'll say this, same, I'm in kind of same boat with that. And, like you said, it's not that we haven't been studying, because we've been studying together and stuff, but it's just really getting on that crunch time where, we talked about at our study seminar that, now we know what we have to do and what, subjects to study on, study more on and stuff. But it's really not till that crunch time where it really like kind of pushes you and kind of really challenges you to, one, learn all of the knowledge, but also kind of like apply it too. Like, because now we're also in our last semester. So a lot of like studying, the book work is also correlating with our actual, appointments and stuff like that, like the clinic. So you're applying it too.
Yep.
But yeah, so I would say that it's not so much a time frame, like everyone's different, first and foremost, but also too, like I work well when it comes to pressure, like as far as, like knowing that it's coming up and really, I wouldn't say cram studying, but there's definitely a part of it that is, the week before, no matter what you're doing, that's cram studying, but is really like pushing myself like, okay, like I know I have to know this by this date. This is when I need to do it. So being 2 to 3 months out, it's kind of hard to really hound in so many hours a day to it and so many hours a week to it, where I know like my mindset was, obviously just study as much as I could. And that's really just kind of what I've been doing. It's just whenever I had free time, review stuff is really more, I guess what I would say is more reviewing than actual studying.
Yeah. And I agree with that push and giving you that drive, like, okay, you kind of feel that date coming. That's when you actually really start to get going. And that's why I think we're starting to get to that point where it's kind of starting to be that time. And I know spring break is when I'm kind of allotting basically that week for myself to just sit at home and study, because at that point I'll be within that 30-day window. It'll kind of be a good time where I'm not doing anything else. I'll kind of have a lot of the coursework done for this semester so far. And
it's a balance. That's the other thing.
That was a big part of why I haven't been focusing on it as much as I wanted to. Just we've had a lot of other stuff to handle in this past semester. So getting all that out of the way first, and then being like, okay, now I can change my mindset over and just focus on this.
Yeah. To really like go off that too is like having the right mindset. Like you said, like for me, I have to be like clear-minded to actually like retain information and learn it and like want to learn it too. And it's not that I don't want to learn the information, but it's a lot, you know? So to actually retain it, you have to be free of, you know, stress that's going on or, you know, your personal life. Like you have to kind of like, I guess I wouldn't say block it out, but there is a portion of it that you just really need to just, all right, put it to the side. Now it's time to, you know, shift gears. And getting up to, I guess, you know, up to this point, you know, where it's like, you know, like you said, like 40 days or give or take that, you know, it's hard to really get into that situation, that mindset, you know? So it's hard to sit down and study for hours at time, you know, and knowing, okay, we got an exam next week or we have a project due or a paper due or whatever it is. Like it's hard to kind of just dedicate to that because you're like, okay, it's not there yet. We're not there yet. We're not there to that crunch time. And as I don't want to say like we're waiting till last minute to study because we've been studying. It's not that. Yeah. And I guess this will go into like, I guess like methods of studying. Like obviously we know we want to like study as much as we can, but you know, I guess it also depends on your methods of studying, you know, getting into that mindset and what works for you, you know. And one thing that I've learned about all of the studying and coming from like that, you know, review seminar and stuff like that is, you know, doing so many subjects in 3 days was great to really get that. It's almost like a brain overload, but it was good because it's like, okay, I know I touched on all of this stuff, retaining it, not so much a month later, all of those stuff in 3 days, but it was exposed and you know how detailed you need to go into that information. And
I feel like with that, you get a lot more of that overlap. So you can really kind of see the correlation between the classes. I know we definitely talked on that before.
Yeah.
But doing it so much in such a little period of time really helps correlate that. And you kind of get the full feel versus the subjects being sectioned off so much.
Yeah, exactly. But also too is like that also goes into like all the different methods. So like, you know, how do you actually study? Like, as far as like, there's so many different study strategies, whether you're a hands-on learner, whether you're an auditory learner, whether you're a repetitive learner, you know, some people just needed to hear things or, you know, or write things, you know, there's so many different ways to study. So I think it also depends on how you learn that, you know, I think that plays, I would say the biggest role for me because, you know, like I said, it's not that I haven't been studying or, you know, you haven't been studying or anything, but it took me 2 weeks to get through oral path. And it's because that was so much detailed information. And I mean, I can truly say that I don't remember every detail. Like if you challenged me on, you know, explaining a certain type of, I don't know, disease or abscess or, you know, I probably can't tell you every description, but I think that now I'm okay enough to, you know, kind of dissect a question
and recognize it if it were to come up. Yeah.
Yeah. So, you know, that was like kind of like my method of learning is it took me that long and I had to sit down. And what I do when I study is I have my, you know, study book, you know, or seminar book, and I go through the whole chapter or subject, you know, on whatever, you know, for example, oral pathology. I take notes and what sticks out to me. So like a lot of the stuff that's in there, it's kind of basic stuff. So I don't need to continue to read that over and over. So I picked out stuff that I maybe didn't know, or, you know, I know that's going to be, you know, tested on. And that's what I took notes on. And I wrote that. Then I would read it back and then I'd go to another resource. So then I'd go to a different book or maybe go back to our actual course information or PowerPoints, and same kind of thing. I'll run through it kind of briefly. If there's anything that sticks out that I didn't have in one resource, I get it in the other resource. And then after that, like second resource of me reviewing that chapter, then I'll go back and test myself on, you know, going through the question. So I wait till I go through probably 2 resources, maybe 3 resources, give or take. And then I start testing myself on how am I, you know, going to, you know, retain that information because, or did I retain that information? Sorry. And that for me has worked the best because I will say that answering those questions after, that is the best way to then learn, because once I'm taking those review questions, whatever I get wrong, I go through them and I don't stop when I'm going through it. I just take it. If I get it wrong, move on. And then I question. But I don't know if everyone does that. I think that certain people will stop when they don't know the answer of the question, and then they'll look into it and go into it. But for me, that doesn't really work for me, because now it's almost like I got thrown off of what I was doing, you know? So that doesn't really work for me, you know? So I have to get it wrong. And then once I get it wrong, then I go back and I actually spend some time. Okay, like, why did I, dissect the thought process? Why did I think it was this? Or did I just completely not know it? I need to study this.
Yeah.
So I guess what do you do when you actually sit down and actually go through a subject? Or how long have you been taking to go through subjects? Because like I said, oral pathology took me 2 weeks, but I know that was going to take me a while, and that's why I wanted to take my time with it.
Yeah. Well, I want to say I like what you said, how you look at multiple resources and kind of see how they each present information, because some of them will focus on certain things more than others, or you might find that all three of your studying books are focusing on that one thing. So it's like, okay, this is kind of important if they're all pushing it. So that's a good way to do it. And I'd like to utilize that strategy a little bit. But as far as what I've done, I've been using the board review book, and then I like making Quizlets. And I know some people are kind of iffy about Quizlets or Notecards, and our instructor was like, everything when you do that kind of gets put in a washing machine and just kind of cycles around and kind of blends it all. There's not really a way to separate it. But that for me is what works. I just need it repetitive. I need it over and over and over again before I really get it into my head. I can't just look at something once or twice and it be there. So for me, that's how I do it. So I have my board review book and kind of go through the chapters, and like you said, focus on one thing at a time, one subject. I haven't bounced around, and then just put all the little details. And then for the rest of that day or the next day, I'll just go through that Quizlet whenever I have time. Like I'll be making dinner, and then while I'm waiting on something to cook, I'll just open up Quizlet and start going, or I'll be on a walk with the dog and I'll start flipping through Quizlet. I just need that multiple times a day, anywhere I'm at, whatever I'm doing, and I can just open it up real quick and look at the different subjects. And I'm keeping them short. I'm not doing 60, 70 question Quizlets. They're only like 15, 20 max, because that's focusing on that topic, and specifically in that topic, one like topic or idea. But I've been spending anywhere between I think 3 days max is about what I've kind of wanted on a subject right now, just because when I planned it all out on a calendar at first, 3 days gave me like a whole month to get through every subject that was in that book. So I was like, that's kind of a good time, because then I'll be at that 30-day mark, and then after that I can go back over and really know what I need to study, because there's definitely some subjects that I don't feel confident in yet, and other ones I'm feeling better. So those ones I'm not is where I'm going to start out at my 30 days. Focus on those, of course, first.
Well, when I say that also too is like, it's not, when I say it took me 2 weeks of oral pathology, it's not literally like 7 days a week that I was, spending on oral pathology. It's just that the time frame of balance of what's going on and stuff, I would say probably out of this 2 weeks, I would say a good maybe 6 days, probably 3 to 4 days each week was dedicated to that, specific subject. And it's also because I'm a very slow learner, to be honest, so like reading and actually like writing and then reading it back. And what I do, I'm a visual learner, I'm a hands-on learner, so I like to color coordinate everything. So like all of my subjects, I'll have the subject, whether it's a specific pathology or a specific definition, I'll put that in a color, then I put the definition in a different color, so that way when I review it, that sticks out to me, that's the word, and then this is the definition. So I'm very much a visual learner, and auditory too. So like even with, like I was saying, how I go through, the chapters, it's hard for me to sit there and read. I'm not good at reading, for hours at a time. So I'll read it. And then once I'm done with all of my testing and I need to review it again, then I toss on one of the, seminar lectures on that subject. So that way I can actually hear it one more time from somebody else. So it's like almost like somebody saying it to me. Now for me to, it's almost like a weird conversation, which I know we've talked about in one of the episodes too. It's like having that I don't know, it's just like almost like you said, repetitive, but that's my way of being repetitive and having that drilled into me is like somebody else is like, hey, you need to do this, like you need to learn this. So like, that's like how I kind of go through each subject. And, when I say 2 weeks on a subject, I actually, at first, when I first started studying right after the seminar, I was going through, a subject basically every 2 days, give or take, like you were, and I'd quickly fly through it. And I wouldn't say that I went through every subject that we need to know, but I realized that I wasn't retaining or learning anything from going through it 2 or 3 days. That's why I kind of scratched the whole like calendar aspect of like, okay, today is, periodontology, or tomorrow is, radiology. Like, it was too hard for me to switch back and forth. Like, I can't do it. So I had to spend a long time because, like I said, I'm a slow learner. So that is how I am grasping, moving on. And that's also the other thing, is going to that next subject. Like, I wouldn't say that I was like, yes, I got oral pathology 100% down. Now I'm going to move on to something else. I don't feel that way. I don't think anyone feels that way. So I think it's just once you've spent enough time, that for me, once I got basically, I would say 80 or 90% of the questions right, I know I'm okay overall. Let's move on. That's how I'm kind of gauging what I'm going to the next subject.
Okay.
And like with pharmacology, when you go into these subjects, you've already, pre-assessed, you've already taken, certain things. So what subject's going to be weaker or stronger for you. So I'm starting with, like I know we talked about that in our boards, is, what subjects we needed to spend more time with. And when I say our boards review episode, which subjects we need to spend more time on. Oral pathology was one of them. Pharmacology is what I'm doing now, so that's a long one. And then I'm going to take a break and do something a little bit easier, and then I'll go back into something hard, which I would say probably be like radiology after that. But
I think that's what I'm getting ready to start.
It can get overwhelming with so many, like, I guess, in-depth subjects.
Yeah.
So, it's just to each his own, the way they study or the way that person studies. But I think it's cool to hear different other opinions or standpoints on certain subjects or, studying for the test, because everyone's a different learner.
Yeah.
You have, I think it was like, I don't know, there's like at least 7 or 8 different learning methods. You have your visual, you have your verbal, which I can say, I guess I'm a little bit of the verbal, because even coming on the podcast and talking about a specific, subject basically is our way of studying in a way, because we're challenging each other and being able to talk on it, Same thing with our presentations in community, talking on, oral hygiene instruction at home. You're being challenged to now speak on that actual subject. So you're applying that. That's why, kind of correlates with clinic.
Yeah, because you can have it straight in your head all you want, and then when you actually go and try and voice it and say it to somebody else, trying to get those words to come out the right way and in a way that they're going to actually be able to understand.
Yeah.
Really helps you get the knowledge of that subject and can help you like feel that you've done it correctly.
It's like a reassurance for sure.
Yeah.
And then you have like even social learning. Like social learning is like, studying in groups and we've had a couple times that we've, sat down and studied different subjects. And I think that helps because, you can have different, mnemonic devices that, you guys can kind of like laugh about, know, and, that's something that, we've done, cause we'll like, you'll come up with something and I'll just laugh at it. And, believe it or not, it registers, you know?
I know I'm already thinking of a few. I'm not going to say any of them, but
I've
got a few of them in my head right now.
Well, it's funny because it's also tailored to that person. And I think that we connect on a social level that it sticks with us. So I think it can be beneficial to study in groups of people, but it also depends on that group of people.
It's got to be the right dynamic for sure. Because I've heard other groups say that they've went and studied and, there's just that one person that kind of overtakes the group, or there might be 2 people that overtake the group, and it just, then those 2 are kind of battling it out and everyone else is kind of just like sitting back, relaxed, or you might be that one person that's like not interactive with it. And
correct.
But sometimes that's also good to just sit around and listen. So it's like, I don't know. It's the groups are iffy.
Yeah.
But it's like I said, it's everyone's different learning style. Some people are better in bigger groups, smaller groups, whatever works for you though.
I think if you were able to coordinate the groups, like if you were able to say like, hey, we're all studying this, we're all going to meet up and go study, not so much show up and study. Like it's like, okay, what have you been studying? What do you feel good about, or what do you don't feel good about? And you know what, I'm going to give my presentation, or you ask me questions, then I'm going to ask. Like, I think if you coordinate it according, you know what I mean?
Yeah.
Versus just sense. Like, you know, like saying, hey, let's go just study this subject, or hey, what, you know, because then you're also, I'm not going to say wasting time, because I don't believe in really wasting time. I think everything happens, you know, or,
something out of it.
You're getting something, regardless of what it is. But it's also too is like, okay, you're going to spend a lot more time at that study session coordinating.
Yeah.
You know, so I think if the coordination goes, you know, prior to that, it helps. And I think that goes into really like logically, like learning, like, you know, like, okay, I know this, let's talk about this. And why do you like think this? Like, you know, then it's more of a conversation and you benefit.
Okay. I see what you're saying.
But and then I guess, you know, off of the social learning thing too is, you know, really seeing, I guess, your overall, you know, assessment once you're, I guess, done studying subjects, or, you know, having those big tests. And the reason why I say that is like having those mock board tests, or those, you know, mock standardized tests, like those are really gauging where you're at. It's not going to really, I mean, at least for me personally, I don't think it benefits me doing that, you know, and having all of these questions and constantly like taking questions, you know, it's just going to test your knowledge. It's not going to benefit you studying wise, besides recognizing some of those questions, which is good, you know, so like recognizing the questions, if you know it and you know the answer, then yes, that is good. But, you know, doing 200 questions at a time, I don't see how that could really benefit, you know, somebody, because they're not going to remember 200 questions. Yeah. You're not going to recognize those 200 questions
without doing anything in addition to studying just that. Like, if you're doing some outside stuff and you want to tack on 200 questions, you can mentally get through that every time you study. I mean, hands down.
More power to you. For sure.
So I mean, just sitting down and taking one of those things wears me out. I'm drained after that. Like, I don't want to study anymore for the rest of the day.
Yeah.
So I can't do those mock boards too often. I mean, I like the little 10 question when there's an app I have. I get 10 questions every day.
Yeah.
I like that. That's good for me.
Exactly.
And that kind of, in the random subjects every day, I don't have to pick the subject. It just pops up and I kind of go with it to test myself. But I agree. You can't do those mock boards that much.
Yeah.
I just can't get anything out of it.
Yeah. At least knowledge wise, like Correct. It's just, you know, it's good to see the, you know, be exposed to it, be ready for it, and see where you're at. And, you know, but I think it's just doing a little bit at a time. And I guess that really sums up all of this different studying is like, how long do you spend like actually studying like in a day or a subject, or like, do you take breaks? Do you like...
Yeah, that's what I wanted to ask you too, is also time wise, like the time of day.
Yeah.
So, but I'll answer yours first. I'll say I usually can do like, probably, if I'm being honest, probably about no more than 3 hours a day.
Yeah.
I kind of cap out.
Yeah, I will say about the same for me too.
Yeah.
And I'll say I go I'm going to say probably 45 minutes, and then I have to take a quick little.
And I used to try and hold myself to an hour, and before I got to that hour, like I would set a timer. I would set a timer, start studying, just not even have the timer off away. And then by the time I was kind of worn out, I would look at it. It was always around 45. So 45 is kind of where I had to cap it. And then I need to go do something, like get up, walk around, go on, do something active for a little bit, whatever it is, 30, 45 minutes again. And then I can kind of come back. And what time of day do you study? Do you find that you work best at some, or they're all about the same?
Yeah, no, I definitely work best at night when it comes to studying. And the reason being is because right before I go to bed, I'll, you know, review, or I'll kind of like test I'll do some questions right before I go to bed. And right before I do that, it kind of, I guess, processes while I'm sleeping or something. Okay. You know, I'm not a brain surgeon, but something happens when I'm in, you know, certain parts of my sleeping through the night, that it helps me to get that information going into like later in the day. I really can't study much like in the morning, just because I'm used to like doing different things, and my mind is elsewhere during the day.
Yeah.
And I think personal life too happens during the day. So studying in the evening or at night is best for me.
Yeah. See, I get up, I eat breakfast first thing in the morning. I'll sit down. It'll be 7:30. I'll start, and I'm good up until 9:30, 10 o'clock. After 10 o'clock, nothing productive happens between 10 and 3. I don't know what it is. At the middle of the day, I can sit down and I'll literally be there with my book open, computer studying, going, nothing's going on in between those hours. It's just, that's my time of day. My brain just needs a break.
Yeah.
So I've kind of figured that out. And then back at the end of the day again, 5, 6 o'clock, I'll get going again. But at that midday, I don't know what it is. It's not efficient for me. I don't know if it's just the study methods I have or what. So maybe in the middle of the day, that's when I'll start, like when I'm actually trying to go as much as I can. Maybe in the middle is when I'll listen to some seminars or some of the review and do more of the listening versus actually trying to write things and read. And I'll save that for the morning. That might be my technique I go with.
Yeah, no, for sure. And that's another thing. All the different styles and stuff, like even like with pictures, like, there's so many different podcasts. There's YouTube videos. There's, the different, study seminars that you can listen to, auditory wise or visual or, so many things. And it really just depends on, that person and also the subject. Like, we can, I guess, just kind of wrap it up about like, the different anatomies and stuff. Like you have to see pictures on that. So, even if you're not a visual person, like you have to become a visual person when it comes to anatomy or, I guess you're still going to have some type of visualization, even if you're a memorization person when it comes to that. So, I know one thing that you've done is you printed out a bunch of pictures and you're, hanging them up and doing it that way. So, I think that, tell me a little bit how I guess that's going, I guess.
Yeah. So I got the idea from a classmate. I'll give it out to Lauren. That was her idea. And I'm sure she got the idea from other people, but I just thought it was a really good idea. And because I have my desk surrounded with them right now, that's where I started, was with the desk. And then I started to take it around the house. So I've literally got things in the bathroom, in the kitchen, in like on the stairs, like everywhere around the house. I've got some things set up. And I know our farm teacher also touched on it, like just having your mind kind of like categorized. Like it's basically like a filing system for your head.
Correct.
So you kind of have it like, okay, in the kitchen, I'm learning whatever about this subject. And then when you try and recall that information, you're like, oh, I remember that was in the kitchen. And then it kind of just places it in that folder for you. The one issue I'm having right now is I just started doing this the other week, but actually reading these now, like the one in my desk, I think I need to limit how much I have there. I've got too much going on at the desk.
Yeah.
I've got too many things and too many subjects all in one area, and I'm just overwhelming myself with what I'm looking at. So I kind of need to spread them out a little more, but I do like the technique and the categorization part of it.
It's association with location.
Yeah.
So you're like, oh, I remember being in my bathroom and remembering learning, this muscle and trigeminal nerve or whatever it is, like that is where it's just association.
Yeah. And the drugs, I wish I would have tried it back when we were being taught farm, because we had the same lady teaching us it when we had it that we did in our review the other day. And I didn't use it in farm. I thought it was the craziest idea I ever heard of. And now I'm over here trying it. I think for farm, it's going to be a game changer. Well, I think that's what I need.
So I actually did that for farm when we were in class. It didn't work for me.
No?
Nope. Just because it was just too much information. Like I kind of did it like for our final and stuff. And, I put different classifications of, drugs, in certain rooms or bathrooms, like you said, same kind of concept, but it was the reading part of it. So if it was more of a visual, like if I would have like, I don't know, like had a picture of a certain color pill in the bathroom, I would have remembered that, but that's because I'm a visual learner. So that didn't really work for me then. But now that I have a little bit more knowledge and I understand it, I do believe that I am getting ready to do that. So now I know like the endings of the drugs. So I'll remember. So it's more than just going in the bathroom, remembering, penicillin, tetracycline, like every antibiotic. So I think it's just it can work in different ways is what I wanted to say about that, because I did try that, during our final. I it didn't retain it much, but I did make posters because I know that you printed them out on 8.5 by 11, like regular paper.
Yep.
But I think doing posters and a little bit bigger helps.
Okay.
Because you can write, or you can visually have it on a bigger scale. I don't know if that's because I'm that blind that I need my glasses to see it bigger. I don't know what it is, but that for me helps. And I did that in Pharm. Like I wrote down the drugs, whether it was the cardiac drugs, all on, a sheet. And I also did color coordination again I did them all in red. So I remember, a certain drug written in red, and that's cardiac for, heart or whatever, so that's kind of my visual, I guess, learning strategy.
Okay. And I remember they were saying even put them on a different colored pieces of paper, which kind of goes along that same line. And I do want to say, I don't just have pages of my textbooks ripped out. They're like actual pictures. You printed out. Yeah. Well, and that they're pictures. It's not like I've got a whole page and a half of words for all of them. It's just
you don't have 250
reading the walls. Yeah,
you don't have one whole wall dedicated to one
or
subject.
They're things that I can't get straight, or there's one thing in a subject where I'm just like, what is that? I always come back to this one thing and I just really can't remember. It's things like that.
Yeah,
those little key things that you really just want to get in. And the thing that I like about it is you can always change it up. Once you get this idea and you're like, okay, you know what? I think I got that. Take that one off. Put another thing up, or next to the picture, I'll have my little mnemonic device, or a handwritten thing of how I would like to remember it, or something like that, just to piece it together to make it a little more customized to myself.
Yeah. Well, mnemonic device is always going to be customized to yourself. Yeah. Because even I think everyone has their own dirty mnemonic devices that they remember certain things. And I think that, whatever works, no matter if it's inappropriate or not. I mean, we won't come on the podcast and talk about that.
That's what I was saying earlier. I'm not going to say ours on here.
But at the same time, that works, for that person, or, how you remember it. And I guess the last thing, before we go into our dental term is just, I guess about note cards. I think that is a big thing. I think everyone... I noticed I used to be a big note card person, but I realized it really didn't benefit me on unless it was straight memorization. But even with pharmacology, with that kind of subject being basically memorization, it doesn't work for me.
No.
I can do certain things. It's not that I'm not, because I do use them. It's just that I can't do 300 note cards and learn them. I'm not gonna. It's just I'm not gonna memorize it. I'm not a memorization. Where some people are, they got photographic memory. I can't do it.
And I could do 300, just not a stack of 300. I could do. I'm not real quick on my math right now. 300 is kind of a weird number, but I was gonna say, let's make it 100. I'm not gonna do a stack of 100, but I'll do 5 stacks of 20.
Yeah.
And do them throughout the day, and I'll get it. But if you just give me a big stack,
doesn't work for
not
me.
going to happen.
Yeah. But that's, again, to show you the differences, of how people remember certain things. So, it just depends on the person and how they want to, utilize their information and their tools. And that's the thing, having, different, pieces or walls of your house, that's just you utilizing your tools that you have, where you don't realize you have those, So if that works for you, use it. Or even in the car, whatever it is, there's so many different ways to go about your study method.
Oh, I haven't told you how I hung up the pages of my cards yet? No, not yet.
Cody's back windshield is all the head and neck anatomy. So
I was wondering why that person was driving around behind me studying the past 5 miles.
Yeah, they're pointing at their neck with you when they pull up on you. All right, let's go into our dental term and...
Dental Terms 102.
All right, so today's dental term, I had Cody throw me out a subject so that way I could get something for it. So he chose periodontology. So I am going to ask you what you know or how to calculate CAL.
Oh,
what does it stand for?
Oh, right in the math. I like this one, actually. At first, this was ridiculously insane to me. I was like, oh, I will never grasp this concept. But CAL is
what does it stand for?
Clinical Attachment Level.
Okay, so before you answer what exactly it is, let's just go ahead and start doing cases because this is going to be a big part of our test.
Yeah.
So a person has a 4 millimeter probing depth and they have a gingival margin level of 2 millimeters. What is the clinical attachment loss?
Attachment loss. Yeah. Can you say the two part again? I got the first. I got the probe depth was 4.
And then gingival margin level is plus 2 millimeters. So basically it's 2 millimeters.
So, but I know it. So the only reason I'm making you word this weird is I know in the cases they will either say there's some kind of overgrowth or will say there's recession.
Correct.
But because you gave me the plus now.
Yeah, that's why I said plus.
So there's overgrowth. So say this patient has gingival hyperplasia. That's why they may have overgrowth, right?
You're saying everything right. The only thing is that the plus doesn't mean that. It would be negative for that.
Okay, wait.
So if you're seeing an actual,
they've got 2. They have gingival.
They have 2 millimeters of recession.
At this point in the case, I would go over to my pictures that I'm provided, those wonderful pictures.
Yes.
And take a look at their tissue.
And see if it's
tooth to see
recession
which way it's going,
or overgrowth.
Or overgrowth.
Okay.
So then why'd you say it's plus 2?
So when it's plus 2, that means that it is basically 2 millimeters of recession.
Of recession, okay.
So when it's 2 millimeters, right, from the gingival margin, right? That's why you're saying plus 2.
You know what I was forgetting? I was forgetting the whole CEJ thing.
Correct. If it's 2 millimeters from the gingival margin,
yeah,
whether it's plus or negative.
Yes.
If it's plus, that means that it's 2 millimeters of recession.
Correct. Yep.
If it's negative, that means that it's coming over the probe and means, or from the, gingival margin, which is overgrowth, and that would be negative.
Correct.
Okay. But
you may not see it presented in the case as negative. They might just say they have overgrowth of
correct.
2 millimeters, and you'll have to know, okay, the overgrowth.
Well, I pulled this from a case, and it shows you a negative 2 millimeter.
Oh, okay.
Or, I'm sorry, positive 2 millimeter gingival margin.
Okay.
So that's why it doesn't say overgrowth or recession.
Okay.
It just says gingival margin plus 2 millimeters. And then what is the clinical attachment loss?
Oh, okay. So I think I was thinking of it different. Yeah, because GM is gingival margin. Like thinking back into our class now, when we're doing it on our perio chart, you mark the GM is 2, probe depth also 2, and then your CAL is 4.
Correct.
So,
there you go.
Okay, so go back to the question again, though. You wanted to know the CAL is what you wanted to know.
Correct.
So we had the gingival margin is 2, and what was the probe depth?
4.
4. So the clinical attachment on this one would be 6.
Yes, the clinical attachment loss would be 6.
Would be 6 because you do your gingival margin of 2, then you add in your probe depth.
Yeah.
To it. 6 would be the correct answer there.
Yeah, exactly.
I was getting too excited about gingival hyperplasia.
But you were saying it right, though.
What drugs increase gingival hyperplasia?
Phenytoin, dilantin. But you were saying it correct, though. You understood the concept, but that plus and negative threw you off. But because that plus 2 doesn't always mean that you're adding it. If that makes sense.
Yeah.
So or the negative doesn't mean that you're subtracting it.
Yeah, and that's where the concept when we were learning it really was throwing me off because I was like, wait, it's recession's down. Why are we adding on to the attachment loss? But that they've already lost that, and then you're adding on the probe depth more that they've lost. And then vice versa. When it's overgrowth, you would think, oh, I'm adding this onto my probing depth, but you're actually taking that away. Exactly. From your depth because that's growth that is added on that's not supposed to be there.
All right. So I guess there's one more keyword I want you to remember that our teacher always told us to remember what the CAL means. Or what recession is what of the CEJ?
Apical migration.
Good job. So that way it kind of ties in that recession.
Yeah, that one's stuck in there on the side of my brain. Yep. Got a little nice tattoo on the inside. It's not going anywhere.
Good. And yeah, so you got it. I mean, you got it, but you confused yourself at first, but you got it. So, that wraps up this episode. Thank you guys for listening. If you aren't following us on social media, please go follow us on social media. Our website will be up soon. If you want to support the podcast, please go purchase some merch on the website once it goes up, and it will be a limited drop. So you have to get it, while it's on there, because it won't be on there forever. So, that is, our exciting news, I guess, that we're looking forward to. We've been working on it day in and day and night, basically, on that, on top of studying and on top of all of our studying things too. But it's been nice to, kind of basically almost be done with it at this point. Yeah. So look forward to that. And if you guys have anything for us, make sure you reach out to us on social media, or if not, just reach out to us on becauseteeth@gmail.com, and we'll see you on the next episode.
Why do we do it?
Because teeth.